Think you're paying too much for a medical procedure but feel you don't have another choice? What about heading overseas? It is a real option and a growing one. Here to tell us more is Josef Woodman, author of the book, Patients Beyond Borders. Joseph, thanks so much for being here. For the first time this year, the number of Americans going abroad for procedures will exceed foreigners coming here. Where are they going?
Oh, they're heading overseas for they're going to Panama, they're going to Costa Rica, they're going to Mexico, they're going as far away as Asia, Thailand, Malaysia, India, Turkey, Philippines. There are probably 20 or 25 top healthcare travel destinations now where patients can travel to one of any of 240 JCI accredited, American accredited hospitals, the same agency that accredits hospitals here in the United States like Harvard and Mayo, and they can travel to receive anywhere from 30 to 80% discounts on their health care.
Wow. Hey, it's Brian Sullivan. What's the risk? I know they're accredited, but are they more risky statistically?
Statistically, no. For example, Wokhart, it's a heart hospital in Mumbai, India. Has performed something like 15,000 surgeries at a 98.6% rate for heart surgeries, success rate, which is right on par with any heart hospital like Cleveland Clinic in the United States. They're fully JCI accredited, and they actually have an affiliation with Harvard Medical School.
Are these hospitals actually aggressively courting American patients to get them in, and why can't we try and do that here?
Well, we were the #1 source, go-to source for health care. We have ceded that to other hospitals that have been a little bit more innovative. But the answer is yes. You have international hospitals like Bumrungrad in Thailand, Anadolu in Turkey, Sime Darby and Prince Court. All of them are beautiful JCI, American accredited hospitals, fully English speaking, and they are aggressively courting the European audience where there are longer waits for health care due to their universal health care system. They're actively courting a U.S. audience of 70 million uninsured or underinsured Americans who are seeking lower cost care. So yes, they see a large opportunity there, and our healthcare institutions, our providers are falling down on the job and not globalizing our care the way our auto industry has and the way our hotel industry has. You can't go into a city overseas and not see a Hilton or a Sheraton or a Four Seasons, and yet our Harvards and our Mayos are not responding in that way.
So, I mean, is that your recommendation? I mean, should we then do that? Should Mount Sinai open up a branch in Mexico City? And so, you know, you can go down there, 50% discount, you know, with the plane fare, it's a 40% discount, but American doctors.
Well, the model should work. It's just that our hospitals have traditionally been more backyard, and we've sat on our laurels in our #1 position and not really done a whole lot. While I think there was a Barron's report just released last Sunday, I think, that showed something like 15 hospitals, publicly traded hospitals overseas that are growing like crazy. They're very, very successful, very profitable. Bumrungrad, for example, world's largest international hospital. They get something like 20,000 American patients. They're building hospitals in Cambodia, in the Philippines, in China.
Quickly, are Americans, by going overseas for procedures, participating in socialized medicine somehow and benefiting from the costs provided by these other nations?
Are they participating in
socialized medicine? You know, are they benefiting cost-wise from the spending of other nations?
Oh, well, yeah, most of the hospitals they're visiting are actually privately owned hospitals, so they're not public health care institutions at all. They are benefiting from the cost savings due to the fact that there's less bureaucracy, there's more efficiencies there, there's less malpractice and lower cost of living. Those are the main drivers. It's not socialized care.
Joseph, thank you for being here. Josef Woodman. The book is Patients
Thanks for having me.
Beyond Borders. If you want to take a trip and, you know, get your heart worked on. Thank you, Joseph.